On to item 8G and H, we have Mike Mize here today to give us a little bit of an update on the improvements projected for the Oklahoma State Fairgrounds and the Senior Health and Wellness Centers. Mike?
Mr. Mayor, council members, manager, I'm happy to be here. We brought this before you last week, and Councilman Ryan requested that we provide a presentation on these two items, which we're going to do this morning. So we have PowerPoints available for you that summarize what these project requirements documents consist of and what their purpose will be in the MAPS 3 process. Project requirements have been used in other MAPS projects going back to MAPS for Kids and the original MAPS projects. They serve two primary purposes. They're to provide guidelines for architects and engineers who are selected to actually do the design of a particular project. And they also, in the case of MAPS 3, provide a summary for the MAPS 3 Citizens Advisory Board and the subcommittees to allow them to better understand what the specifics of a project may be going forward as they work with those architects and engineers. The development of these, we use a number of resources to develop these project requirements. We have consultants of our own who have specialties in the areas of each of the individual projects. In the case of this, the Fairgrounds project requirements, we also utilize the Oklahoma State Fair Master Plan. We've talked a number of times with Fairgrounds staff. We've incorporated some City of Oklahoma City engineering standards. We've had input from the subcommittee, and we've collected data from a number of other sources. The contents of these documents include a background or history of the individual project, a project description, a description of the site, and an analysis of the site where that's available. With some projects, such as the wellness centers, we don't have sites yet, so that's not included, but there is a description of what some of the desirable features of a site might be. Space descriptions and functional relationships, design standards, and I'll give you examples of all of these things as part of this presentation so that you'll be able to see examples of these individual categories. And then obviously budget and schedule are as approved by City Council in the implementation plan. The process has been that we've developed draft documents. They've been reviewed by the MAPS staff, then submitted to the appropriate subcommittee, received and incorporated by those subcommittees, sent to the advisory board, which has recommended their approval, and then sent on to City Council. After City Council approves them, they will go on to the architect or engineer who's selected for the individual project. Some specifics about the Oklahoma State Fairgrounds improvements plan. Phase 1 is limited to effectively site improvements, although it does include a limited master plan as well for the area surrounding the Exposition Hall to make sure that ingress and egress are maximized and consistent with the goals of the remainder of the fairgrounds. The bulk of this first phase will be parking and infrastructure, including sewers, lighting, underground electrical, possible permanent restroom facilities. Phase 2 will be the new Exposition Hall of approximately 300,000 square feet. The design standards, and what I've put up here is kind of a summary of the things that are included in the design standards. In the actual project requirements documents which you've received, there's a fairly extensive list of design standards that are specific to each of the individual projects. But the kinds of things that get considered as part of these design standards are climate, circulation, access, parking, grading, utilities, site amenities, landscaping. One specific example on the fairgrounds for the first phase, the carnival area that is part of the fairgrounds requires a significant amount of electrical out in the parking lot area, but the design of that has to be in trenches, which allow for a lot of flexibility in terms of setting that up and for multiple kinds of events. So there's some specifics about things like that in these design standards. Then architectural considerations, the general character of the improvement, flexibility and expansion, making sure that they meet codes, accessibility, life safety, interior design, site amenities, landscaping, and then any special features that may apply to a specific project. This is an example of what we refer to as a bubble diagram. It's not a scale drawing, but it's designed to give the architect or engineer on the project a feeling of how spaces need to relate to each other, adjacencies that are required, and how the building will function the building or the facility will function once it's completed. And this is derived, in the case of the fairgrounds, from our discussions with fairgrounds staff and with our consultant regarding how an exposition hall might best work. Once again, these are guidelines for the architect or engineer who will have a significant amount of contact both with the subcommittee and opportunities to work with, in this case, the fairgrounds staff. These are based on conversations, again, with the fairgrounds staff and with our consultants, suggested sizes and types of spaces that would be included in the exposition hall. The budget is straight out of the implementation plan. There are no changes in the budget. The schedule.
Can we go back to the budget? Just
certainly.
Look at that a little bit more closely. There we go. Okay.
Okay.
Excuse me, may I ask a question? On that previous slide where you showed the...
Thank you. On the previous slide where you showed, yes, that one right there, Exhibit Hall A, B, and C, are they designed where they could all be opened up to one large facility?
Yes, sir.
Okay.
Yes, sir.
Okay, thank you.
The goal is to have one very large space that can be divided into smaller spaces so that there can be multiple events in that building as well.
One other question, if you don't mind. As far as the components of the new exhibit hall, when we have heard discussions from the convention center, I'm sorry, as far as requirements for upgrades in the electrical and the data areas to accommodate computers and things like that, have you visited with them as it relates to the fairgrounds? I know there are different types of exhibits, but I would suspect, if not currently, that the demand for those types of issues will be here before we know it with respect to their types of conventions and exhibits.
And actually, those are part of the design standards. There are some specific suggestions in there. There are significant power requirements depending on the type of, for example, if it's a trade show, it's going to have different kinds of power and networking and internet requirements than some of the other events that would take place at the fairgrounds. And the goal is to build in as much flexibility to that space as we possibly can so that it can optimize its rentability.
Thank you.
If that's a word.
Okay.
Okay. Any other questions or comments on the fairgrounds?
I have a question, Your Honor. Mm-hmm. Mike, on the parking lot design.
Yes, sir.
The fairgrounds has probably one of the ugliest parking lots in the country. but it works well because it accommodates a lot of horse trailers, and I think that's great. But parking lots typically are not very attractive. Is there any guidance in this particular document that would direct an architect or consultant to include some landscaping or improvements in at least what some people would consider improvements in the appearance of the parking lot?
Yes, sir. There are some guidelines in there with respect to landscaping.
That would impact the parking lot area?
Yes.
Okay, thank you.
Okay. Questions on the fairgrounds? All right.
Okay, we'll go to the next presentation. Some portions of this are identical to the presentation that we just made with respect to the general nature of these project requirements. Those slides are the same. Sorry? Oh, okay. With respect to the wellness centers, we used a different set of resources. We have a different consultant for the wellness centers who's a nationally recognized senior wellness center expert. We used, again, Oklahoma City engineering standards in some places. We used the AIP study, which was presented to the subcommittee and to the advisory board to try and develop some general standards for the wellness centers. Input from the subcommittees, and once again, data from other sources, including sources here in Oklahoma City and nationally. We've looked at a number of other wellness centers across the country to try and develop some of these guidelines. This slide is effectively the same. So is this. Process is the same. Senior wellness centers. If you've had an opportunity to look at the two documents, they're very different in size. The wellness center document is much larger, and in fact, it's a little bit easier to develop a larger set of standards for the wellness centers because of the building type, and there are a number of special uses within that building type that need to be considered, for which we provided guidelines for the architect and engineer. But some of the overall things that need to be considered, we know that we don't have a site plan for a wellness center because we don't know where they will be. They'll be in different areas of the city to serve different populations and possibly different demographics. Each facility needs to reflect the nature of its surrounding neighborhood. We think a very important guideline. The current budget, as we understand it and as we have worked with it, should fund the construction of 4 different centers. Amenities in each of those facilities may be different based upon the needs of that individual community.
Mike,
yes, sir.
Excuse me for interrupting you, but,
sure.
but this is a point that when the first responses to the RFP came back, I became a little bit concerned that maybe we have the template that we use is a little too tight. And this is where I'm coming from. I had originally contemplated that the wellness centers would be vastly different. They wouldn't be just a little bit different. They would be tremendously different because if we're going to ask people to handle all the O&M, then it has to be something that's going to fit with something they're already doing. I had perceived a situation where one entity might do a wellness center that would focus on, say, the medicine side of it, like the University of Oklahoma at the Health Sciences Center might do one, but it would focus on the health of elderly. I mean, they have all the students there, nursing students, dental students, all those people, and it would be a high-level medical type facility. One might be someplace else, maybe perhaps one in southeast Oklahoma City that would be focused on, it'd have a medical piece to it, but its emphasis would be job retraining or people that are age are starting to want to do other things. Maybe they need to be retrained for another job. Maybe they just need to do something to keep their mind active to be able to enjoy their later years. One at perhaps at OCU that would deal with the arts, and it would have just a small wellness piece. And it seemed like we lost that. It seemed, now I'm not sure I'm right about that because I wasn't there. I haven't listened to all the things, but it seems like somehow that's gotten lost in it, because I think if you're going to get people to, again, I've already said this, but I think if you're going to get people to put the O&M up, you're going to have to find, the hook has to be baited with something that is part of what their mission is already. And it seems to me that somehow these templates were drawn so tightly that they're all going to be pretty much the same. And they may be different architecturally, but they're going to be the same. And I worry that we're not going to be able to attract people that'll put the money up to make it work unless we find a way to entice them by letting them design the plan. I may be wrong about it. Like I said, I wasn't at all the meetings, and I don't know. But when the bids came back, we got one from a demographic that just wasn't a good way to do it. It just was, to me, on its face, the demographics of one of those applications wasn't good enough. Now, I don't say it wasn't good enough. That's bad. I don't mean it wasn't good enough. It was inappropriate for what our overall idea of where a wellness center should be located. That's what I mean. It was good enough. Certainly, that's a bad choice of words. We had people that were the community college, for instance, which carried the torch for this thing. They endorsed the idea in the election. They found it impossible to bid because of the restrictions that were on it. I worry that we've somehow, in the translation between the idea and the cold hard facts, we've lost something, and we may have lost the ability to do it if we do that.
Well, Mike, it seems like, I mean, for a lot of these projects, the Achilles heel is that there's no money for operational budgets, and it seems like the first casualty may be the wellness centers. We got two from the YMCA and the City County Health Department. We're left with those two, and neither one both have problems. So I'm wondering, can we get to 4? I mean, can we get to 1 or 2, much less 4? Is there anything in this that restricts us from changing strategy if we decide that we can only get 1 or 2 viable partners?
I don't think there's anything in this particular document that restricts that. Like I said, these are guidelines, and we've encouraged in these documents diversity based on a geographic neighborhood. And the size of there's no limitation on the size or a maximum size of any of the individual components within these documents. Once again, these are guidelines for what might be considered a typical senior wellness center throughout the country. But it doesn't limit them specifically to you have to have this component, you have to have this component, and the percentages between the two have to be exactly the same going forward. As part of the frankly the operating partner process, which you described, which you both talked about, was intended to try to be open enough so that, I think it was a fairly open process, and I think that's demonstrated by the fact that we got 2 very different proposals.
Now, I would say that what we saw when we put out the initial kind of RFP was great enthusiasm that seemed to diminish the further we got down the process, and in some cases incomplete. I would say at this point, I don't think we've fully vetted the concept with the prospective operators. I agree with that. I think we need to go back to them, talk to them a little bit more. I agree. Before we say it didn't work. Let's open our eyes to new things. I think we need to fully vet the current process first. Go back to them, and I intend to, go back to these operators and talk to them. And I still think, though, that there are opportunities with larger scale developments who might want to do something that's senior oriented, where this could be plugged in down the line too. And I'm a little bit disappointed we haven't seen the development community come forward with some larger idea of a larger development. Knowing the demographics of the senior population in this community and almost every community is going to explode so rapidly and on a predictable basis. That I think this can be a very important component to something very special. Right. So,
I think one thing we might look into is if they're all not going to offer everything, which I don't think they all should have to offer everything, but that we work something where we have a transportation system built into it, so that we make these accessible. If you live in South Oklahoma City, and say for my idea that the University of Oklahoma would put a serious health-related facility there, and you needed that there'd be some way you could get from South Oklahoma City to that facility. Or if OCU, for example, could be convinced to make an arts function part of theirs, that you could get from Northeast Oklahoma City to the campus at OCU. I think a lot of them were put back also on this city-owned land thing. I don't think that I know that Oklahoma City Community College was absolutely, that was almost a deal breaker for them they maybe should have known it, but I flat didn't know it, and I don't know that any of us around the Horseshoe realized that was one of the requirements before we got started. Probably should have, but I don't think we did.
I think that's something we can work through. I think there are ways to help get through that issue.
I think there are too.
I think when we started on this, we first of all, this is still a bit amorphous. This is still in the formulation stages, and I don't think we've excluded anything at this point in time. I think we were hoping, as Mr. White and Mr. Cornett have alluded to come up with somebody whose mission is out there and help them further their mission, right, and do that and bring some operating dollars that they have to further their issue, whether it's helping some social challenged areas, whether it's to be in health, whether it's to be in recreation, whether it's to be in education, whether it's to be in arts, and to kind of funnel that into another facility that's doing, and the synergy between those would make it work. Obviously, there's all kinds of recreational facilities, rec centers that work, YMCAs and health and fitness centers that make it and are paying the debt service on it. Right. I mean, there are doing that. So having a building out there and just looking at the operational costs, if you can blend that with somebody that already has a mission and some operating dollars to perform that mission, that's very helpful. But we're kind of plowing new ground here, and people are a little hesitant to step up and right, jumping out and doing that. But we're still hopeful that we're going to find something. Maybe it's going to be City County Health. Maybe it's going to be the YMCA, the two that have done more. Maybe we can team with an educational facility. Maybe we can team with an arts facility, a social services provider, somebody that's already has a mission of providing these services, and get the right marriage going. I think there really is potential for this. We just haven't come upon the right one at this point in time. But it can be flexible to meet whatever needs we need to do for the community and for the provider and for the city. I think there's
how much discussion have we had about teaming with a teaching hospital, about seeing patients there and generating revenue by providing health care at the wellness center? I mean, is that something we're exploring with?
We've actually had some interest from a couple of health care related facilities and who have expressed some interest in doing that, but they, for timing reasons or whatever, have chosen to step back on this first solicitation and look and see what happens forward.
I get the feeling nobody really wants to be first.
I would say this. I would say we need to be, I think it'd be better if we were more deliberate in this process and not rush into this. Maybe even going back and saying, instead of 4 facilities that are going to be awarded approximately $12 million, would it be better to limit it to 2 or maybe just 1, and then you could make a facility that would be $50 million, for example, and it would be more centrally located? The proposal that was submitted by the YMCA, and it's a great facility, I mean, it is first class from a health perspective as far as exercise and swimming and treadmills and all that. I don't think you could find a better place, and that's the one on 119th and South May. It's great. You've got Early Wine Park there for you have access to the whole park. The problem with it is such a nice area. The community that surrounds it, from an economic standpoint, could all afford, I'm saying they all could, there could be some exceptions, within 3 miles could all afford a membership fee to the Y. The new South Oklahoma City Library over there on 134th and Penn provides certainly books and movies and some activities that meets the requirements for the arts and continuing education perspective, as well as the tech center down there at 134th and Penn. And then you've got the community college just down the street on May Avenue that can certainly provide with the continuing education and their new performing arts center and allow senior citizens to get involved in those kinds of activities. I just think now that we've gotten some information, let's not rush into something. I'm not saying let's don't go forward with this, but let's see if our original thoughts can be achieved, and if they can't be, well, I don't see a problem with rethinking this whole process and trying to come up with a good solution versus just accepting what's being presented to us as far as potential partners.
Skip?
Well,
I understand the dilemma in reference to finding people to partnership with this, but I would just like for us to be mindful of the fact that this was one of the projects that drove more to the polls than any of the projects. And a lot of people that voted for this project were people who fell into what we would call the senior category. And they expected to see something in reference to their vote, I think, in a reasonable period of time. I hope we don't get to the point where some of those people are no longer with us in reference to the opportunity to participate in some of these projects. And, I knew that this was going to be a challenge from day one, especially when we knew that we were not going to be the operator of the facility. But as I look at some of these features in the packet, and being a member of several fitness programs here in Oklahoma City, this is far and beyond some of the features that some of the top class wellness centers, fitness centers that you have that's private. And if I don't know how much we've looked at other cities that have some of these programs, but I just don't understand why it would be that difficult. Being as Pete stated, some of the corporations and some of the institutions that we have here in Oklahoma City that's well anchored here, that if we just loosen up a little bit and let them give some dictation, some direction to this, I think we could do this. And if we don't have to do but one, if we just did one in any part of the city, and of course each one of us would like to have bragging rights to say that I had the first one in my ward, but if we just did one and used it as a starting model, and for whatever the identified features are, but I think that the main features that we got to stay focused on is the fact that, if we say wellness, we got to have something that's major factors of a wellness program. And, I just think that as Pete stated, maybe we are too tight with this whole, presentation, and that, maybe we need to let some of the potential operators or interested operators, or maybe we solicit to them and say, what would you be willing to put in, and what would you be willing to be responsible for the operating of a facility and the components of it? Because as I look at some of this, if you go to, I don't want to start calling names, but you go to some of the top fitness centers right here in Oklahoma City, you won't find some of the features that we have listed. Most of them don't have a walking trail, a walking track on the inside anymore, but at the same time, I think that, we could develop the project where it would be at least, open enough to get one of them started, I think.
Somebody else want to talk? Gary and then Pete.
Just a couple more things. Just
Go ahead.
Who else? Go ahead.
Go ahead.
No, just a couple more things. One, I think I agree with what Skip's saying. We need to open it up. We need to make people know, the potential proposers need to know that this is a much more open process, I think, than this document reflects that it is. I'm not saying it's not open, Mike. I'm just saying I don't think the document does a good enough job of reflecting this open attitude that you're hearing here. I think we ought to talk about locating in a park. I look at what's happened in the park that's at 46th and Walker, that's just south of the Variety Care. A different constituency there, but that park is a little bitty pocket park. It is working in a way that beyond anything I ever imagined it would work. I mean, the people that are at Variety Care are there using the park. It was city-owned property, the park was. We have other parks like that throughout the city that this kind of a facility could be used in the same sense that the Boys and Girls Club we use this memorial park. There's parks all around. And the third thing we might look at is whether or not, I said I had two and I lied, I have three. Mick knew I was going to lie, though. He already knew that. The third thing is, if in fact somebody can build it or needs support, we ought to look at whether or not a portion of the adequate share could be put in an endowment, and some of that money then, that if it was built for less than that, some of that money used for O&M. I'm not saying we do that, but I'm trying to think outside the box for ways to satisfy somebody that doesn't have a good operating stream, that might be a good operator. We could supplement the stream, say you only get $10 million, you build in a city park, you bring your folks in, we will put $2.5 million in a fund, and you get the money, like the community foundation operation, you get the money. May not be legal. Kenny probably would have to tell us whether that's legal or not, and I don't know whether it's a good idea or not, but it is an idea. It's just, I hate to see it struggle, although I agree with David too, that we don't need to rush, but it just seems like we're almost at a standstill with it.
Yeah, I don't think we're there yet.
Well, I hope you're right. I
don't think we're there yet. Gary?
I just want to make sure we all understand what I think are some of the problems with this that I've seen in the past year serving on this committee. And one of the best suggestions that I heard was the suggestion of a coalition or a nonprofit be formed that all the entities could belong to and provide their services as the coalition placed them here and there or moved them around, so that you didn't have an entity trying to run it, but you had a coalition of all these people. But having said that, none of that came forward or seemed to move very far. In the vetting process that the mayor suggests, and I wholeheartedly support that, to me, listening to what the people had to say in that committee for the last year, the most important vetting that we need to do is understanding what it's going to cost to run these things. Because I don't believe you have currently anybody out there that says they can run it without annual dollars from the city. I also think you've got three distinct groups trying to fit into these centers. You've got groups that talk about education and learning and culture and the community center look to them. You've got the group that talks about the clinics and the health and welfare part of it, and then you've got the physical fitness side of it. And you have partners that are good at one of the three, but they're not necessarily good at all the three. And if they were good in one, they were going to have to reach out and find the other two and try to find a way to make that work. But I didn't hear any of them say that they could do it inside their own dollars, even with a free building. Hand them a free building, and all they've got to pay is the operating cost of that building and their staff, and I still didn't hear anybody come forward and say that they could do it. So I just caution us before we go down the road and actually get to the point we're going to build that first one that we fully vetted whether this count. And I'm not saying we should or shouldn't. I'm not taking a stance on pro or con of annual operating costs, but I think this council needs to know exactly what it's getting itself into before they build that very first one. Because if it's going to take annual tax dollars every year from here on out for 1, 2, 3, 4, or 5 of them, I think that we need to understand how that's going to impact us on an annual basis.
Gary, I would say that even the partners who have submitted proposal have at least informally expressed their concern about the ongoing maintenance cost and whether or not they will be able to maintain that facility in a manner that they'd like to see. So I think that's something we really need to get a good understanding on before we really release that first one. Now, having said that, I am a big proponent of this. Conceptually, I think it's great. I think we ought to focus on what we can do for the seniors of Oklahoma City, and I'd like to see a solution develop here. In Ward 5, though, I just have a belief that it needs to be towards the northern section of our particular ward, whether I-240, Southwest 59th Street, because I think many of the citizens in the further southern part, a more affluent area, have access to a lot of these things, maybe not at one stop, but like I said, you can go to the Y, you go to the technical center, you can go to the library, you can go to the college. It's not in one location, but all of these things are accessible, and a lot of the people in Ward 5 have the ability to pay memberships and pay for these things. I think, or at least my understanding was, we were going to try to place these in locations to where the immediate community was not as affluent, who were not able to access these things on their own, and the city was going to assist them in their ability to access this. And that's what I'd like to hope that we keep that in mind. And again, I like it. I think these are important. But I don't want us to rush into something and then have some regrets after we've started with this project.
Meg, and then Pat.
Just a very quick comment, though, David. I think when we talked about this and we looked at models in other cities, North Little Rock being one that was discussed quite a bit, it was largely supported by membership dollars. And so, we need to be cognizant of locating this in a place where membership dollars are a big part of the ongoing ability to manage the operating costs.
Okay.
All right. So. Pat?
I think it's been a great discussion because I think this is one of those projects that was, unbeknownst to us at the time it was adopted, is the most difficult project in our whole MAPS program because of the definition was sort of hazy and the operating relationships were sort of blue sky almost. But I don't think, having said that maybe I'm wrong, that all this discussion has any bearing on this document at all. This document doesn't propose constructing any building. It just says if you build a building and it has X facilities in it, these are the standards you'll use. So I think we could, I would feel comfortable adopting the resolution this morning on this particular document and then continuing discussion on how these things are going to be located, manned, and what specific entities each one will have, amenities each one will have.
But I'm in favor of the document, and I agree exactly what you said. But just since Mike's here and we're having a discussion about maps, I just want a little tangential, but 3 requests. Number 1 is that I think Gary hit the nail on the head on operational costs. This isn't going to be just about senior wellness centers, but I would encourage vetting as fast as possible the operational costs of all these projects, transit, the convention center, the park. Number 2, I would ask that you move the date or the schedule of the convention center subcommittee. What comes out of that committee causes ripples to go through the system. Now, I've heard from 4 different sources that the convention center subcommittee wants to close the Harvey Spine, for example. I want to go to that meeting, and I've requested this already, and we didn't get anywhere. But to have that subcommittee meeting during city council meetings on Tuesday mornings means that none of us can attend. And so I'd ask that be moved to a time. I'll come any other time during the week except during City Council. Number 3, if you haven't read the article this morning on public works and planning and by your smile, I assume you have read it. I think that for me, and I know this is tangential to this, but it is so important in terms of maybe some of the shortcomings of the process. It's unclear to me. To me, planning should be central at this point. And I think Oklahoma City government is very public works centric and goes and marginalizes the planning department. That's just my own individual opinion. And I think the opposite should be true at this stage. It seems to me, attending some of the subcommittee, that everyone is being considered in isolation. And somebody needs to look at the big picture and figure out how all these entities are going to interact with each other. What's the impact of the convention center on the park and vice versa, on transit on the convention center and on the park and vice versa? And the people who have the long-term vision, the 20, the 50, the 100-year vision, as opposed to the 2 or 3-year vision, is the planning department. And I just don't think it's fair to ask public works officials to be solely in charge of selecting, for example, the architect or the designer of the Central Park. If you have 5 spots, it's not clear to me at all why 3 of those would be engineers from the Public Works Department. You'd have no one from the Planning Department, and you'd have 2 people, have good intentions, but they have no training or in terms of planning or managing designers, managing planners. They're novices in that field. But regardless of who they are, if you have 5 spots and 3 of them are from the Public Works Department, they have a majority regardless of what those 2 believe. I'm concerned. I think that we can learn from some of the hiccups in Project 180. And I think some of the same themes we're seeing is that I think it was very public works centric and planning was marginalized during Project 180. And I think we could have improved, but I'm very concerned that that's happening now with these multiple MAPS projects.
Your Honor,
let the city manager respond to.
I just want to make one comment, if I may, before the city manager. I think Councilman Shadid is spot on target in terms of this goes. But I think we, the council, would benefit by a presentation from the Public Works Director or the Assistant City Manager in charge of that about how this process really works, because I don't think there's a thorough understanding at the horseshoe level of how the process works, who is included, and how they determine which architect or engineer to accept. And I think that might be helpful for the whole process.
We'd be happy to do that. Let me cover a couple of things responding to Mr. Shadid's comments. First of all, we'll look at the operational costs. We've done that before, probably before you were here, but we'd be happy to do that again and to update that. We can look at moving the Convention Center subcommittee. There were some issues with that, but we'll be happy to go forward with that again. Regarding to planning, I have a MAPS 3 meeting every Monday morning with Mr. Todd and Mr. Winger and a couple of others. Recently, I've added Mr. Mize to that meeting, and Russell Klaus attends that meeting. So we sit down there, and I do value Russell's input as we go forward on that. Russell was involved in the review of the proposals that we received on the parks process. We got a great selection process. We had 16 national firms, really nice submittals on that. The interviews, dates are not still set at this point in time. We're having some problems with struggling getting that set up. The process that's lined out has been by ordinance, or not by ordinance, by resolution by council, is that I have a representative, the user department, who's Mr. Todd, and the Public Works Department sits on that. We add users to that. And we've adopted a policy for the MAPS 3 process that those users are members of the subcommittee that are being involved. And they're involved in both the culling process when the proposals come in and review that, and also on the selection process as we go forward. I can give up my seat to Russell if we need to as we go forward on that. I don't know if I have a problem with that or not. I really hadn't thought about it until I read the paper. I didn't know I had an issue until I read the paper this morning. But we can certainly discuss that and go forward with that. But I do value the planning process. We are implementing them in there. They do come to the meetings every Monday morning now, so we are trying to get them involved as we go forward. I've been involved in literally hundreds of procurement selections for professional services over the years. And it's always a fun process because you got people that are trying to sell you and they got great ideas, and you got some of the, we're able to attract some of the best in the world, not just the United States, in the world, to come and look at this. We've got firms from London on this and from outside, some really neat ideas. And it's a fun process to go through and listen to that. Generally, when you get into a situation like this, there isn't a bad decision to be made. I mean, you've got 2 or 3 of the best, and they're really good, and whichever one you choose is going to be fine. But it's also generally a consensus decision when you get in, and rarely is there a dispute as to how that is involved. Councilman Sellier has asked to sit in on those processes, and so I believe that she will be sitting in on the interviews if it meets with her schedule. They have not been set yet, so as that comes forward to do so, it's you all can't be there, but I wouldn't, we don't have a problem with that if you wanted to sit in and take a look at that. But we're pretty blessed with the amount of talent that our projects are attracting right now. One, they're big, substantial projects, but with the slowness of the economy elsewhere, we're really getting the pick of some really, really nice options out there.
Gary?
Well, I just want to, and I'm not trying to do a rebuttal, but I just want to make sure people understand that Mike and his group, and Eric and then David, have gone out of the way to make sure the committees intermingle. They haven't done anything for the convention center that the parks or the transit committee didn't know about or get the same presentation, and vice versa. The convention center got a presentation on what transit was talking about and what they were talking about for the line, and the parks, how the parks heard about the convention center and how that was going to interact and all that. So, and I haven't seen very many meetings that Russell hadn't been at. So planning is aware of what's going on with all those. So I just didn't want you to think that a lot of that was going on in the dark, because those committees are talking. And it's not unusual to see a Parks Committee member showing up at the transit meeting, or the transit committee member showing up at the convention center meeting, or whatever. So it's not like this is all being done in a vacuum out there. There is a lot of interaction going on with it.
So we're on the same page. We want maximum integration of all the different subcommittees. And even, I would say, the Myriad Gardens staff. We had the administrator of the Myriad Gardens. She was not very aware of what was going on in Central Park and that programming. I mean, even merging those. I mean, those are 2 parks right by each other. I mean, they should be integrating maximally. So just maximum integration.
We agree.
All right. Larry?
Yeah, just to go back where I thought we were heading with this. The document that we have before us right here, Mike, with respect to the Wellness Center, this is what the committee, the subcommittee on the Wellness Center, is recommending the components be for a senior wellness center. Is that correct?
Yeah, in some relative proportion.
In some relative proportion.
Yes.
And as I recollect back to the original discussion on maps 3, there's nothing in this document that should be a surprise to any of us, because all these components were discussed in one form of detail or not. Were they not? I thought they were. And all along, we knew that one of the key things to doing this was where the center and centers would be located geographically, and we've already talked to that. And one of the key components that we were hoping to have done was that a person would come along and operate the center for us with no financial involvement of the city once it was built. And that may or may not prove to be a viable thing, and we need to address that. The question of, I think Meg mentioned North Little Rock. In some of the earlier discussions, North Little Rock was kind of held up to us as an icon of what a senior wellness center should look like. Am I off?
It is one of the ones that has been held up across the country as a model.
And there's a number of other models across the country that have been held up.
Correct.
Okay. And the document we have here reflects the thinking of putting those thinkings together in this document right here. So this wasn't done in total ignorance of what a senior wellness center should look like.
Yes, it's designed to provide a program for the physical facility that would have enough flexibility in it to provide different kinds of functional programming for the individual centers if they're different and located in different areas. That's the goal of this document.
And when I was reading this myself, I looked at this and I thought, these components here are what, in my mind, the vision for a senior wellness center encompasses. It's not the same as some of the other things that I've heard here, and I could be wrong on that. So I think, this document, we're asked today, Mayor, to approve this document as a guideline to go forward? Is that what we're discussing here?
I think we're substantially saying that we're in the right direction.
Yeah.
Continually going in the right direction. It's our chance to meet and discuss it.
I see this as going, quote, in the right direction, unquote. And the comment was made about thinking outside the box. I've been accused of being a little bit screwy on that idea because we had a armory that became available to us. Didn't we, Jim, down in the center part of town? And I said, why don't we think about that? And somebody mentioned, it may have been Gary, somebody mentioned Will Rogers Park as a potential location, which fits the park mantra that we're talking about. After the discussion on the infamous cell tower last week, my wife and I went out that night just for a further investigation, looking at this property from a different area. And I threw up to Dr. Shadid, and I think he was ready to get the psychiatrist after me. Why not that location? And why not go with, get Integris Hospital excited and take the Pacer Center, which is just a mile to the north, and move it down there? I mean, let's market this thing to the providers. I think what we've been up to this point, we've had a product, but we haven't gone out and sold the different people who can come up with the money to operate this thing. So I don't think the sky is not falling. I think it's time to move forward, and let's get some creative thinking and let's go forward with this. That's my sermon.
Okay. Mayor,
Skip.
In due respect, the one problem I have with this is we send this as a resolution, but we have in here project requirements. How do you sell something to someone that you want to participate? You need their money, you need their resources, but you're saying these are the requirements that you have to have. That's why I said, why can't we wait and ask the providers or any of those individuals that we're trying to solicit to say, what would you be willing to give, or what would you be willing to participate as part of a program in a wellness center? If you say that your project requirements are each one of these identified components of this package, well, if you say a health clinic and you got to have an examination room and all of those components, and at the same time you're looking at maybe Metrotech that may be an interested party, and they don't want to go that far in reference to a real doctor, nurse, patient relationship as it relates to a wellness program. And on the other hand, you have, where you have a cafeteria style of, I think, for nutrition. All wellness centers don't necessarily have to have a nutritional program in reference to feeding. But that's why my concern is that if this is the resolution, we're saying, then if we vote on this resolution, we're saying project requirements, that this is what you're taking to anyone that you're trying to solicit to be a part of this program, and said, if you're going to participate with us, then these are the requirements that have to be part of the program. That was my concern about.
Councilman, we've got a little bit of an issue of a chicken and an egg situation. What comes first? We've got to start with something. And so we've put out the program requirements. If a service provider comes into us and says, we'd like to do this, but we can't meet A, B, and M on what you're saying on the requirements, we'd be happy to take that back and bring that back through the committee process and to the council and see if we can get something to go. However, our partnering agencies out there, they're asking, what do you guys want? And so we've got to start somewhere and begin the negotiations back and forth. And you've got to have something to start with. And we're proposing that this is the start point on this. That doesn't mean at all that this is where the finish point is. But these are some expectations that we'd like to see met. And if somebody comes back in and says, we'd like to run this, but again, we're not going to do this part and that part, we'd be happy to take that down and back through the process and to the council to try to get going, but we got to start at some point.
Well,
Your Honor,
promise-
I'd just like to say,
okay.
this is sort of like a menu in a Chinese restaurant. One from column A, one from column B, one from column C. It doesn't describe the whole thing. And I think we're losing sight of the fact that this is a list of the way certain aspects of these things would be constructed, or could be constructed.
Yeah.
And we're not talking about every center using this, all the features in here. They may, but that's not what I think the intent of this resolution is. This says, if these are some standards we're going to adopt if we go forward with these kind of amenities. And I think they're flexible. If we had somebody come in and said, well, I want to do everything, but I don't like the finishes you suggested or this, I think we have the flexibility, even with this document, because they're guidelines. They're not an official contract to do anything.
Ready to move on? All right. Mike, thanks very much.
Thank you. If I might have just one moment of privilege, I want to thank Councilman Mize for his year of service to the MAPS 3 committees and subcommittees. I don't know that he missed a meeting the entire year, and we appreciate his input. And we're really looking forward to Councilman Ryan filling that role in the coming year. Thank you.
How about a motion on item 8G? Cast your votes. Passed unanimously. And 8H. Cast your votes. Passed unanimously.